Hi, my name's Angie. I'm a physical therapist, friends with Dana, and so today we're going to talk about the IT band. And so it's important to know where the IT band is and how it inserts and why it's inflamed. So we start up here with this muscle called the tensor fasciae latae. It turns into this piece of band, this piece of tissue that comes clear down here, inserts over here called the IT band. It gets really tight with runners, so I know today we're focusing on runners, how to help them make it through the marathons without hurting and aiding in maybe even preventing any injury during that marathon. So when I have a lot of people come in for IT band syndrome, we focus on how to hurry and get that inflammation down. So the biggest thing is to not take one of those big massage guns and just crank on your IT band, because that will actually make it really sore at first. That is something you have to ease into because the IT band is a little princess. So to start out with, I like to get to my kinesio tape, and I'm a big snob about it. I like my rock tape because it's really firm, it stays on the patient really good, and it has a lot of good results. So what you want to do, and even before I start, if you've never seen kinesio tape, it's specially woven. It's like a cloth tape, so it lifts up the top layer of your skin and it lets inflammation subside underneath, whether that inflammation is residing in muscle, tendon, ligament, anything like that. It really helps to take that away quite quick and to provide stability to the joint while allowing mobility for soft tissues. So it's super awesome. So I have my patient here, Dana, thank you. I figure out where it's hurting, I rub over it, and what you can feel are some speed bumps. I like to feel like she has a speed bump right here, right through this area. And I keep rubbing, and usually it's a place where you'll grimace as well if you can't quite tell what a speed bump is. So her speed bump is right here, and often there will be speed bumps down here where it gets super tight. So we're going to start above where her speed bumps are and close up to here where the tensor fasciae latae is as well. So I get my little piece of tape, get it undone at the top, come up higher, you're okay with that. I'm going to tack it down just like that and rub, 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 make sure it's firm. And then I'm going to pull. I like to pull with about a 50% pressure, and if you're wondering what does pull mean, as soon as you start to work with this tape, you'll understand that it has some give. And so pull about 50% power. I tack it down over where that speed bump is, right on top of your speed bump, by the way. And then I let it go down, and if there's another speed bump, I pull over that speed bump as well. And that just gives a little extra help to take care of some of that inflammation. The next thing I like to do is I like to get 2 anchor strips. A couple of reasons. One, I don't want this to come off while I'm running or while my patient is running. We want to make sure that it stays down. And another is to help those speed bumps where there's a lot of inflammation, help it to subside as well. So what I do is I take just a little bit like this. If you round your edges, then the tape stays on for a lot longer. And then in the middle, I break it, okay? So we kind of have a Band-Aid going on for this. We're going to decompress it, and if you can see, there's a cool adhesive. It's a circular adhesive on the other side. That's why it works so well. We've got woven on one side and circular on the other. So I go to that speed bump. I'm feeling it right there where she hurts, okay? I'm going to decompress about 50% from that piece of tape, put it on it, and then just do the rest just normal. Okay, and then we rub, rub, rub. And then I'm going to anchor it down to this area as well, exact same way. And go like that, let it come out, and then I rub, rub, rub. So, biggest things I tell people, if you get red and itchy, take it off. It means you're having an allergic reaction. Okay, if you hate it, take it off. It's meant to be enjoyed, not to be endured, really. So you can take it off and try to reapply it just a little bit different way and to see if that works better for you. Some people enjoy coming from the bottom up rather than the top down. So you got to kind of see what works best for your body. It can make it through 3 to 5 days of sweating and showering. Unless you're a marathon runner, you'll probably want to take it off and then reapply some new stuff because you'll probably have a lot of sweat on it. When you get out of a shower, though, just pat it dry. The heat and the water of the shower will activate the adhesive, so you never want to take it off in the shower. You'll have a little bit of a tug of war in there. The best way to take it off if it's really sticky, you want help, is with either some baby oil or some alcohol, rubbing alcohol.
Awesome.
Okay.
Thanks for all the tips, Angie.
You bet. Good luck on your marathon, Dana.